So this is in book 4, unit 3, MPC 011. We are in unit 3, psychotic disorder due to general medical condition. In fact, when we'll be doing the mood disorders, there is general medical mood disorder due to general medical condition and substance induced. So once that is done, this will be much easier for you. Basically, it talks about neurological disorder that affects the brain that causes psychiatric symptoms like seizures, Parkinson's disease, brain tumor, multiple sclerosis, meningitis, parathyroid disorder, thyroid disorder, adrenal disorder, and sodium imbalance. So these are the neurological disorders. Substances like alcohol, cocaine, amphetamines, hallucinogens, ecstasy, solvents, heavy metals, substances that induce psychotic disorders. Then we have vitamin B1 and B12 deficiency. So if you actually remember these names, you'll be able to write that: seizure, Parkinson's disease, brain tumor, multiple sclerosis, meningitis, parathyroid disorder, thyroid disorder, adrenal disorder. So these are based on hormones: parathyroid, thyroid, and adrenal. Rest, that was brain, multiple sclerosis, meningitis, and brain tumors, seizure, and Parkinson. Then we have imbalance, sodium imbalance, vitamin B1, B12 imbalance. Then we talk about substance abuse like alcohol, cocaine, amphetamines, hallucinogens, ecstasy, solvents, and heavy metals. In chapter so some symptoms of psychotic disorder. If you actually remember, we spoke in the first unit, in the beginning we gave an overview of psychotic disorder according to DSM-5, that if you remember, depending upon the duration and the mood, we actually studied it. So there we had spoken about positive symptoms and negative symptoms. Then basically about delusion, hallucinations. Types, again in the first overview, in introduction, we did speak about schizophrenia, schizophreniform, schizoaffective, schizophrenia high duration, schizophreniform a little bit lower duration than schizophrenia. Then we added short lowest duration, like the postpartum psychotic disorder, because of some presence of some stresses. Just a minute. Yeah, so here it was. So we did speak about schizophrenia. So as the duration increases, more duration, schizophreniform, and brief psychotic disorder. There is this is increase in mood, and this is increase in duration. So this way increase in duration, and this way increase in mood. So here is schizophrenia, schizophreniform, and brief psychotic disorder. Middle, the presence of schizophrenia as well as mood is schizoaffective disorder, and the presence of mood is mood disorder. Mood disorder you have in book 3 actually. Okay, so where we speak about mood disorder and bipolar. So we were talking about the symptoms and types. Causes can be psychotic disorder can be genetic, like when we speak about paranoia, delusion. So remember all the causes that we spoke there. Here it is medical condition due to general mental illness is brain. So there is this neurological cause, endocrine cause, metabolic cause, renal failure, electrolyte imbalance, autoimmune diseases. Again, the one that we studied, like neurological, we have brain disorders like meningitis and multiple sclerosis, endocrine, all parathyroid, pituitary, adrenal. Then imbalance of electrolytes, sodium imbalance we spoke about, vitamin imbalance we spoke about. So symptoms: delusion, hallucination, disorganized speech. If you remember the 5 symptoms that we studied in the first intro of schizophrenia. Yeah. Then here, page number 50, we already went through the types of delusion, because delusion is a symptom, and then the types of delusion. Then speaking about hallucinations, how hallucinations can happen. This is causes of psychotic disorder due to medical condition. So again, the same, we'll speak about brain tumors. These are functional causes: sleep deprivation, severe clinical depression, general medical condition, drugs, stress, postpartum psychosis. Defense mechanism. I haven't actually really gone through this chapter, and so I'm sorry, but then I'm just taking you through this book. Defense mechanism. So previous question had causes of psychotic disorder due to general medical condition, so you might have to look through it. Once I cover, I can definitely share. Then we got treatment, early intervention, hospitalization, medication, psychosocial therapy. The last chapter, substance-induced psychotic disorder. Just like the medical, this chapter that we just covered is the general medical condition, psychotic disorder due to general medical condition, right? This is substance-induced. In mood disorder, you will have last two chapters just this way: mood disorder due to general medical condition and substance-induced mood disorder. Similarly here, psychotic disorder due to general medical condition and substance-induced. So here in the first they are talking about different types of psychotic disorder, which we already discussed. Schizophrenia, schizoaffective disorder, schizophreniform disorder, brief psychotic disorder, delusional disorder, shared psychotic disorder. When a person develops delusions in the context of relationship with another person who already has his or her own delusion, that is shared psychotic. This is new to me. Okay, the substance-induced causes. Definitely, substance-induced is the causes is about the substance. Inadvertently injects toxin, too much of legitimately prescribed medicine, overdose of recreational medicine, continue long-term using or withdrawal. Then drug abuse, alcohol, amphetamines, marijuana, cocaine, hallucinogens, inhalants, opioids, and sedative hypnotics. So environmental toxins. This question has been asked: difference between substance-induced psychotic disorder and normal psychotic disorder. It's the same thing. It's not really tough. They repeated it. Basically, it talks about the onset. Onset is only after the substance is taken, the psychotic disorder is seen. Otherwise, without the substance, the psychotic presence of symptoms are there. Here, the course is after the intake and after the withdrawal period.